The idea that I would like to explore is creative activity and its impact on the well-being of adults recovering from alcohol dependency. I'm drawn to this topic due to my own personal experience of working with people recovering from alcohol dependency and using creative activity as a therapeutic tool and seeing the benefits it had on the mental health and well-being of individuals. Alcohol dependency has a negative impact on well-being, with many individuals struggling with anxiety and depression, lack of roles and structure, and minimal engagement in meaningful occupations. Evidence suggests that meaningful use of creative arts as an intervention could benefit emotional, social, cognitive, and physical well-being. Whilst researching literature, I found a lot of research surrounding creative activity and mental health, as well as for generalised substance misuse. However, I found little focus on specifically alcohol dependency. Recent statistics estimate over 600,000 dependent drinkers in England, and that alcohol is the 5th biggest risk factor for death, ill health, and disability across all age groups. It seems that there's a need for more research into holistic methods of aiding recovery and increasing the well-being for people who experience alcohol abuse. For my research, I will start by focusing on the interpretivist paradigm. The title for this research question is Exploring the Ways in which Creative Activity Impacts the Well-being of Adults Recovering from Alcohol Dependency. In this qualitative study, I will use a phenomenological design, aiming to gain an in-depth understanding of personal experiences, why they use creative activity, and in what ways they feel it impacts their well-being. I would recruit participants by contacting organisations and charities such as Phoenix Futures. Eligibility criteria include having capacity to consent, to be over 18 years old, have a history of alcohol abuse, are in recovery, and have chosen to take up a form of creative activity. I would be looking for a sample size of 6. To collect data, I would use individual semi-structured interviews, and to analyse the data, I would use the method of IPA. Now I will look at the topic from a positivist paradigm. The question will be, does participation in an art group intervention have an impact on the well-being of adults recovering from alcohol dependency? For this research, I will use a pre-test, post-test designed randomised control trial, in which the experimental group will take part in an art group intervention, whilst the control group will be a waitlist control group, who will receive their usual care and will later receive the intervention when the study is over. The art group intervention duration will be 1 hour, twice a week, for 4 weeks, giving a total of 8 art sessions. Eligibility criteria for this study will be the same as the interpretivist study. However, this time I will specify that participants have not yet started on a creative therapy programme. I will be looking for 60 participants in total, with 30 participants per group. I will use block randomisation to allocate participants to groups. To collect data, I will use a wellbeing scale, such as the 14-item Warwick-Edinburgh Mental Wellbeing Scale. This will be used to collect data at 2 points in time, so before and after intervention. To analyse the data, I will use a statistical approach using SPSS to calculate results. The results should show if there are any differences in well-being between the experimental and control group, and whether well-being has been affected by the intervention. Ethical considerations I identified include confidentiality and privacy, and ensuring all participants have capacity to consent. Working with this client group may mean that some willing participants will be suffering from alcohol-related brain damage or Korsakoff syndrome. It's also important to consider the ethics surrounding the waitlist control group. It's considered more ethical to apply this method as opposed to a no-treatment control group. However, this method isn't without its flaws, and may possibly stall effectiveness of usual treatment. Other considerations include considering participants' mental health, and being prepared to signpost if I felt I had any concerns surrounding their mental health. I would also need to consider the possibility that a participant could show up drunk either to the interview or to the art group intervention. I would also need to look out for signs of relapse, or that a participant may be thinking of relapsing. I would need to have sufficient knowledge of who to contact if this was the case.